And we are recording.
Welcome everyone to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm your moderator today, Cincinnati City Council member Jan Michelle Lemon-Kearney. You know, at our last town hall, we focused on Black men. So ladies, today we're going to focus on you as we talk about Black women and the COVID-19 vaccine. So first of all, you know, we have to give a shout out to our producers and tech team, John Reichel and Lauren Harden, for making all of the technology run smoothly. As a reminder, of course, we are recording this session so that we can repost it later on the COVID-19 communityresources.com website and other platforms. To all of our attendees, I know you have questions, so please start entering them into the Q&A if you're on Zoom, or you can enter them into the chat if you're on the Health Books Facebook Live page, and Lauren will make sure that we get those. Okay, and now we have so much to talk about, so let's meet our panelists. We have Dr. Edje from UC College of Medicine, Dr. Sushanna Gordon from TriHealth, Kamara Douglas, who's a young professional, and Jerri Bree Cameron, who's a young professional and also the parent of an 8-year-old. So before we get to your questions, and we already have a few, let's hear a few words from each panelist. Let's start with Dr. Edje, and I should say welcome all of you. Thank you for joining us.
Thank you. I appreciate the platform, and I just want to say thank yous. I do want to go ahead and talk about my perspective and what I bring to the table today, and then just talk about the women piece. So first of all, thank you for Renee Mahaffey-Harris for being an amazing ambassador for Closing the Health Gap. And also thank you to my UC family for trusting me with the message. Second, I am a family physician here in town. I have patients who look just like me, and I have family who has lived through a lot of the skeptical times around clinical trials. And I'm also a Moderna trial participant. This is trial day number 177. So those are the perspectives that I bring to the table. And then thirdly, I just wanted to mention, of course, that women, in my experience and also by CDC data, are really the chief medical officers for our families. They're the ones who 79% of them choose our physicians for the family. Secondly, 77% of them make appointments for the family members. And lastly, 56% are the ones who make the major decisions for health in the family. So I'm really glad to be here, and I look forward to answering as many questions as we can.
So it's really a good thing we're focusing on women today, right? So,
absolutely.
Yes. But men, you're welcome to call in and ask questions. So everybody's welcome. Okay, Dr. Gordon, a few words from you before we get to questions.
Yes, I'm Dr. Sushanna Gordon. I'm an OBGYN with TriHealth. And primarily what I do every day is take care of women of all ages, from teenagers to women that are grandmothers, great-grandmothers. And I'm excited to be present to talk a lot about what women's views are on the vaccine. And I get lots of questions every day about whether or not women should take the vaccine, whether they're pregnant or not pregnant. And I agree with Dr. Edje that, you know, women are really the directors of the family. And so that's the reason I became a women's health professional. And I'm excited to be here today to bring my perspective to the table.
Thank you so much. And I can tell you, we've already started to get questions about women and pregnancy and whether they should take the vaccine. So we're going to get back to that really soon. Okay, Kamara Douglas.
Hi, good afternoon, everyone. Happy Saturday. My name is Kamara Douglas. I'm the Civic Inclusion Manager for our program at the Women's Fund. And I'm so happy to be on this panel to also give my insight pertaining to COVID-19 and how it's affected me as a young woman, and in terms of my friends, family, and even our social lives. And no one ever thinks about the effects that it has, especially when we want to travel and then come back home to our family and friends. We never really take into consideration their health at times. So I'm really happy to lend my voice to this conversation.
Thank you so much. I can tell you, I've known Kamara actually all year, and it's just been. She worked in City Hall before going to the Women's Fund, and she is just smart, just a powerhouse. And I'm so glad you're joining us today. Thank you so much. And now, Jerri, Bree, Cameron.
Yes, hi everyone. Thank you so much for having me today. Well, first, I want to start with saying that I recently graduated with my master's of healthcare at the beginning of COVID.
Oh my goodness.
So I've gotten to,
Congratulations.
Yes.
thank you so much. I got to really be a part of what the pandemic and what COVID-19 has like kind of taken a halt to my progression as someone that's trying to dive into being a healthcare administrator. But I actively work in the community with the small to mid-sized businesses. So I work hands-on with people that have been affected by COVID, like as far as business sales or their operation goes. And just as a parent to a child that, went to school for 8 years of her life, and that's all she really knows, to like having to explain to her like, hey, sanitary reasons, and, when you get sick, and how people are being affected across the world from having COVID. So I would love to, give my insight and just explain to people like what I've seen, and maybe bridge the gap between what people think about the vaccine.
That's wonderful, and I can't wait until we get to talk to you, especially about the parenting part, because parents are just really struggling with this whole thing. And I know children have been depressed, and should they be in school, should they not? So we've got lots to talk about. Let me start with a question that came in early, and it is and it's to each panelist, so you may answer in any order you'd like. But the question is, this is really broad, how has COVID-19 impacted your life?
Well, I could start, I guess. I will say that, prior to COVID, I probably haven't had too many people like reaching out to me. I just started a small to mid-sized business myself called Real Time Gains. And it's pretty much like being a system analyst and a needs analyst. And more people has contacted me to help recession proof their business because of their sales. So the COVID-19 has actually enhanced my business and my life, but at the same time, I've watched the people around me like be affected from social, like not being able to socialize and be out in the community, to, losing people that were close and dear to them. So it's kept me in the house for sure, and have began to be a catalyst for me to figure out other ways to work from home, as well as still help inside of the community as well.
I think that's a big thing. Everybody, the big word in 2020 was pivot. Whatever you're doing, we had to pivot to something else so that we could stay alive and, stay in business. So that's, that's been a real challenge. Okay, Kamara, I see you shaking your head.
I think that's a really good question. I know for me, I actually had a second job for the past few years, and it helped me to supplement my income. So when COVID hit and the pandemic forced a shutdown, I actually lost my second job as a result. And I found it a lot more difficult because although I worked for the city at the time, I was just struggling to make ends meet, unfortunately. And oddly enough, I actually started my company around the time the pandemic started. And just as I was gaining momentum, everything came to a halt. So unfortunately, the pandemic had a rather negative effect. And it really brought into perspective the people that worked in gig industries, in the bars, in the restaurant industry. No one ever took that into consideration. So although I had my full-time job, I'm really grateful for that. I realized that so many other people are really struggling. And then the whole rollout with unemployment was a mess. And there were individuals like myself who couldn't even qualify as a result. So it had a rather interesting financial impact on me. But, you know, at the end of the day, I'm here, God is good. And, you know, we're on to new beginnings.
That's a great attitude. That's a really great attitude.
Absolutely.
Dr. Gordon?
For me, I have a 16-month-old. So at the time that COVID hit, I had just came out of maternity leave actually, and had just returned back to practice. And my practice suffered initially. I didn't have many patients to see, and it was an unsettling time for me as well, as a professional, because I didn't get to come out of that maternity leave with some comfort. I was worried about how my practice would grow and things like that. But over time, we've actually seen an increase in pregnancy, and it allowed me to kind of focus on building relationships with people in the community. I started kind of connecting with a lot of African-American owned businesses, and that actually grew my practice a lot, but it gave me an opportunity to connect with the community in a way that I didn't see possible before. And of course, that also was influenced by the Black Lives Matter movement. And it demonstrated a need that Black women had to find doctors that looked like them. And I really love the opportunity of meeting women and reassuring them that I'm here for them. And that has continued on in terms of those relationships that I've connected with and built, and that are continuing to grow. And I'm still meeting a surplus of new patients who are coming to me because they feel like they finally found a physician they're comfortable with. And as a mom, I've settled into now, you know, being more hands-on because my child stays at home with a nanny and doesn't really have a social life. So it's definitely been quite a juggle. And then also, of course, as a frontline worker, that uncertainty when that first started, because I know for us as doctors, we were being told, oh, you may receive a message that we want you to work in the emergency department or work in areas that you never had experience doing, maybe in the ICU and things like that. So there was a lot of unsettling times. Remember when we didn't have enough PPE and how scary that was to go to work and not know if you would be bringing something home to your family. But now, just like Kamara mentioned, I do feel like I've now received the vaccine and we're moving in that direction. I feel a lot of positivity and hope and restoration of some life, new life that we're now developing.
Yeah, I was going to say, what a scary time to actually have a child, you know, because at that point we didn't know when or if that vaccine was even coming. And,
Yes,
you know,
absolutely.
yeah, and not knowing, you know, if you're bringing something home to a newborn baby,
Mhm.
that's really something else. So, yeah. Okay, Dr. Edje.
So COVID affected me in two different areas, mainly at home initially, and then also at work. So at home, we had the death of my stepmother. Over the course of just about 8 days, she was very healthy and subsequently succumbed to COVID. And that prompted me a week or so later to get involved with the Moderna trial. It was close. It was here at Cincinnati. We're one of 90 sites for the Moderna trial. And so what that did for me is it just helped me to be able to take my grief and place it elsewhere and put it into advocacy. And so that sort of moved over into my workspace. And it allowed me to go ahead and, number one, advocate for residents and fellows, making sure that they had the appropriate PPE, making sure that they also had the appropriate social distancing and all of that done with facilities at work. Additionally, it allowed me, again, to go ahead and advocate at the state and the national level and also at the global level for a couple of different companies for their global task force. So it's been a bittersweet situation. What I don't want to leave this pandemic with is regret. And so, over 500,000 lives gone is horrific to hear in the middle of the pandemic, but to look back and those numbers will just look bigger when we're out of this pandemic. And again, I don't want any regrets. So doing everything I possibly can.
I think, you know, all of you really are letting us know like what a personal impact COVID-19 had. And I think sometimes we forget about that. I think sometimes the public forgets about that. And you all who are on the front lines and having the personal experiences, That's, first of all, I just want to thank you for your service. I know Dr. Edje mentioned being in the trial. You're still in the trial.
I am.
Yeah, and which brings me to another question that was asked. Which ones of you have had the vaccine? Which one did you get? And did you have any side effects?
So I'll start. So I got into the Moderna trial, and as soon as you get in a trial, you get randomized to either getting placebo, which would be salt water, or you can go ahead and get the vaccine. And you don't know that. We were blinded. So I didn't find out until Insurrection Day on the 6th of January that I had actually received the Moderna vaccine #1 in September, on September 12th, and the second one on October 14th. And I pretty much guessed I'd actually gotten the vaccine because the second shot, which is usually more reactogenic, meaning that your body has a bigger reaction to it, my arm felt like a lead balloon. And I knew there's no way that saline would actually do this to me. Again, the side effects from that, I wouldn't even say side effects, your body's reaction, it's only about 24 hours if you're gonna have any symptoms.
So that was it, just a sore arm for you.
Just a sore arm. There are 5 other things I could have gotten. I could have gotten fevers. I could have gotten a mild headache. I could have gotten joint pain, muscle aches, and fatigue.
Okay.
Didn't get any of those.
Okay, and I'll just, let me ask Dr. Gordon, and then Kamara and Jerri, let me ask you too.
Yes, I got the Moderna vaccine. And for me, after the first injection, I had no symptoms whatsoever. The second injection, I did take some Tylenol before, just to kind of help to decrease any symptoms I may have. And I did have a mild headache and some fatigue, but overall I felt fine. I know of other people who've been quite symptomatic, but I was blessed that that wasn't the case for me as well.
Okay, great. Jerri and Kamara, have either of you had it, taken the vaccine already?
I haven't.
Your age group is just now eligible, actually. Yeah.
Mhm.
Starting Monday.
Oh, starting on Monday. Okay. Yeah, I was going to say, and Dr. Edje just dissuaded me of this, but because all the doctors I know have had Moderna, I said, I want Moderna. And so, they all say, whichever one you get is the right one. Like, don't worry about Moderna or Pfizer or Johnson & Johnson, which is just a one-shot deal. So I actually ended up getting Pfizer, and I can just tell you guys, I had no side effects. I mean, my arm wasn't even sore. So, so I feel really blessed about that.
They're all safe and they're all effective. So whichever one comes up first.
All right.
I'm hoping to get the J&J.
Yeah, one
Just the
shot.
one and done.
One and done. That would be great. Okay, so this is for Dr. Gordon. We're going to talk about pregnant women now, because it seems as though the info for pregnant women keeps changing. So first they were advised not to get vaccinated, but it seems like that's changed. Can you give us an update on that?
Sure. So when we rolled out the first phase of vaccination, we know that we start with healthcare workers, and over 10,000 of those healthcare workers that received the vaccine were pregnant women. And in vaccinating those pregnant women, we have not seen any significant effects. Like we're just talking about the mild symptoms, or, potentially the typical things like Dr. Edje mentioned that you may get from a vaccination. But in terms of what the American College of Obstetricians and Gynecologists has said, is that we do recommend the vaccine. And the reason is, when women are pregnant and get any viral illness, they tend to suffer much worse than someone who is not pregnant. They have a higher chance of ending up in the ICU. They have an increased risk of death from that viral illness and more severe symptoms. And so it's much less risky to get a vaccine than it is to get COVID. And without being vaccinated, women are putting themselves at risk of being infected with COVID-19. And so at this time, that is the recommendation from ACOG, is that we do let patients know what our thoughts are on the vaccine, and allow them to decline or accept the vaccine by just educating them on the fact that if they do get COVID, the virus, it would be much worse than if they were vaccinated.
And can you tell us what ACOG is, please?
ACOG, American College of Obstetrician and Gynecologists.
Okay.
And that is it's a national resource that essentially determines what is done in or practices OBGYNs.
Okay.
And it's where we do research, collect data, and determine how we care for patients. So it's what we use as our guidelines. Very important, people.
Yeah, that is important. Thank you so much. So now pregnant women should consider getting the vaccine.
Yes. And I also would like to mention too that Pfizer has started a vaccine trial, and they plan to enroll 4,000 pregnant women. And their plan is to administer the vaccine in the third trimester, starting at 28 weeks. And so I've talked to some of my patients, and I've told them that if they're apprehensive, then they should consider waiting until that time, because development of a baby occurs in the first trimester. And then the baby continues to grow from the second to the third trimester. But a lot of that, the organs and the key things that happen occur quite early on. And I do believe that that is potentially the reason Pfizer is choosing the third trimester. So I've told patients, if they're apprehensive, go ahead and wait until you're about 28 weeks to take the vaccine if you do have that choice. But if it comes around earlier, don't miss your opportunity.
Right, that's right.
So could I add just two things? Absolutely agree with Dr. Gordon. Number one, mRNA, so which would be Moderna and Pfizer, that does not get into the nucleus where DNA is. And I think a lot of women have been concerned about, does the mRNA affect my genetics? Will it affect the fetus? That's not the case. We also do know from a recent study that the antibodies from a vaccinated woman do cross over into the placenta and do give some protection to the newborn child as well. So that's an additional benefit.
Okay, thank you so much. So, let me ask, and you're all young, but let me ask our youngest members of the panel, Jerri and Kamara, what are you hearing from your peer groups? Because we still hear a lot of hesitancy, and especially from younger people about taking the vaccine. So what are your peers saying about it? And we're still trying to get at the myths out there. I can throw out a few, but I'm gonna let you start.
Yes. So some of my peers are, obviously hesitant, just giving the fact that history in testing, for instance, situations like where Dr. Lou had explained, like they gave her the placebo, maybe partnering with, or like the vaccine being partnered with an organization that's non-bipartisan or partisan, that doesn't support Black communities. And they just want to know that they have like the best practices are being like used for them, just historically speaking, so that they feel safe and comfortable potentially taking it. Other than people are revolting and saying no, they don't want to do it, and it's a matter of fear, really. Like it's the chances of them getting a vaccine that takes their life out, they rather take the risk of not having the vaccine and maybe have it live in their system for 30-40 days before it actually takes them out, whereas they have an immediate response or reaction to the vaccine, and they only have 2 or 3 days to live. So
can I answer that one? So to just answer the issues of fear, absolutely, those are founded because of some of the uncomfortable truths. And specifically, if you can imagine that 623 men in Tuskegee were offered free meals and free medical care, and were not given treatment that eventually became available. And that was egregious. There are things that have been put in place since then, like what we call IRBs, which are institutional review boards, that put very, very strict parameters on all studies that are done. And any human trials, there are some very specific rules that need to be kept. And I'll bring this up specifically because of the unblinding visit that I had when they told me on January 6th whether I'd gotten the placebo or gotten the vaccine. The reason they had to do that by law, okay, is because they had found that Moderna was extremely effective and it was safe. And so they had to let us know which we had received and give us the opportunity to say, yes, I want to stay blinded, don't tell me what I had, I'm out of this trial right now, or give me the vaccine. And so since I'd already had it, I didn't get it. I stayed in though, because I want to make sure that I'm in for the full 25 months. So we know how well the immunity lasts in your system.
Yeah, that's a really good point. And Jerri, we get it because there's a lot of distrust with young people, with the Black community in general, I think of all ages, about the medical profession. And Dr. Gordon, you kind of touched on this because really Black folks are so underrepresented. It's great to see the two of you as physicians, but my understanding, and this is from the information from the Black Men in Medicine that we talked with the last town hall, only 4% of physicians in the US are Black.
That is correct. In my class of 220 medical students at the University of Michigan, 15 of us were Black.
And that's just so low. And studies have shown that people tend to trust those who look like themselves. So for Black folks to be able to have access to a Black doctor makes us more trusting, but that often doesn't happen because the numbers are so low. And so here we have, COVID, which is just a crisis. More Black people are dying from it, but we're afraid to take the vaccine. What are we going to do about that?
I was also going to say, what's interesting is that the COVID pandemic happened, but then we also had the, Black Lives Matter movement speaking out about the death of unarmed Black men. And this time around, it really took on that we realized, okay, we need some security by finding each other, trusting each other, and relying on each other more. But just imagine the anxiety that also stimulates while we're in the midst of a pandemic. And I think some of that has carried on. Even as a physician, I thought a couple of times, could I be experimented on? I mean, I think in America, it's hard not to think that way. Doesn't matter how educated you are or how much money you make. There's always a question of whether or not, as Black people, we'll be treated fairly, just like anyone else. And I think that's especially where this comes from. But it's good for others to see that, sorry about that, Dr. Liu, it's good for others to see that we're taking the vaccine and we're doing well, and we're encouraging them to do it as well, because I don't want us as a Black community to be left behind because of fear.
That's right.
Absolutely. Yeah. I agree 100%. And the other thing is just making sure, I think, over time, to make sure that we have those of us who are Black and Latinx to be represented in some of the leadership roles. Some of the, being a private, the investigators, the primary investigators for all these trials. And so this gives me an opportunity to bring up Dr. Covet, who is one of the developers. She's one of the two scientists that helped develop the Moderna vaccine. And she's a 35-year-old Black woman. She's phenomenal. And I think it just makes it a little bit more easy to have equity when you do have people who look like you in the development phases and also in leadership.
Right. And Jerri, let me ask you directly now, are you planning on getting vaccinated?
I've just been on the fence, but I haven't had a, opportunity to get vaccine. One of the questions that I had is, what would be the, issue if you waited? Is there going to be endless supplies? I'm someone I don't take medicine daily. So like, I have allergies and won't take a Benadryl. I'll wait till the last day before I'm like barely able to breathe before I take the Benadryl.
And what is that from? Is that from a distrust, or, what do you think?
No, I actually used to get migraines really bad. So I used to have to be in and out of the hospital all the time. And I just, there was a point in time in my life where I thought I had meningitis. And so from that, I just was like, I just want to see how I can naturally recover. And in 10 years, I hadn't had a migraine that sat me down in a room from, versus me like having, taking Zomeg and nasal spray and all types of medicine and Tylenol, codeine 3, all of those, medicines that weren't like effectively helping me. And so I said, the next time I take something, it would be, conducive to my life, where I don't feel like I took a Benadryl and now all day I'm, can't
Right, you're woozy.
barely stand up.
Right. Well, look, okay, so we're going to ask the doctors. You know, Jerry's got a point. I think a lot of people are thinking the same way. You guys are all getting the vaccine. Maybe I can just wait. Is that what you think?
I actually have a personal story about this because
Yeah.
Through my job at TriHealth, we had to fill out a form. And I did. I was kind of on the fence like you are, Jerry. I don't know if I'm going to do this, you know. And I filled out the form. I didn't hear from them for a while. And I saw my colleagues that were not Black on Facebook. I've been vaccinated. I'm protecting everyone. And I started to become so eager and unsettled that I was going to miss my opportunity. And why wasn't I selected? And then I finally got the email that I was going to get the vaccine, and you couldn't get me in there any faster. And the reality is, soon after that, they did tell us, this is the last time we're letting you guys know. If you don't take it now, some companies actually do give the rest of the vaccines to the state so that they can help vaccinate others. So if you miss your phase, there is a potential that you could miss your opportunity. And I think when you do weigh that decision, use what is happening now. And for now, we know that people are still dying from COVID. The virus is still alive. I still have pregnant patients that are getting a positive COVID test, and they only go to the grocery store, or, you know, a family member brought it to them. And I still have patients who get sick and get admitted to the hospital with severe COVID symptoms. And I think now that it's getting sunny, everybody is getting happy about like you mentioned, Kamara, positivity. We tend to start to not remember what's actually happening. And it's that we're still in the midst of a pandemic. You don't know if your opportunity will pass you. And so I really do believe if it comes, grab at it.
I think absolutely. If we want to get 70% herd immunity, which would mean 70% of the globe vaccinated so that we can get out of this pandemic, then we're going to have everyone try and step up and do it. Otherwise, we're going to be treading water. Just looking at some of the numbers just yesterday, as far as our curve, you know, we've started to see a little bit of a plateau for our, you know, between this third peak, and it looks like we may be heading toward a fourth peak. We have rising cases in 26 states. So while people are starting to open up, you know, again, just like Dr. Gordon said, people are sort of getting a little bit more comfortable with, you know, not socially distancing and not wearing their mask and not doing, you know, their hand washing. We have to stay vigilant, and we have to get to 70%. Otherwise, we won't get out of this at all. It'll just be a cycle.
Okay.
You know, it's funny that you said that, because I was talking to my best friend who is a council member in Maryland, and she was telling me how they were opening up different vaccination clinics within her community and within the lower income communities. But instead you had people from outside the city,
Sure,
from different ethnicities, specifically coming to the Black communities to take the shots. And I just thought how selfish that was. And, you know, I even learned how people were lying just to get the vaccine, to skip ahead of those who really needed it. And I just can't imagine how selfish that is. And it's really frustrating.
Yeah, you know, we did hear a lot of complaints about, you know, just people telling us that folks are like breaking the line. You know, they were using their friends to jump up and get vaccinated. But, you know, I guess people are out there fighting for their lives. And so, you know,
They're desperate. They'll do anything. And, you know, a part of the reason why the Black community is not getting vaccinated at the rate that we want is that there are not enough vaccination centers in locations that are easily accessible. Kind of the issue we've been dealing with long term, and it's that access to the resources that we need. And I do feel, and we already know this is an issue in this country, and that the resources aren't allocated equally. And that's why I would hate for our community to miss any opportunity that's presented, because it's not for certain that we will be a priority in the future. So I do say go for it if the opportunity presents.
I think we actually are very likely to have an overabundance of vaccines down the line here. been some major things that have occurred. For example, getting 100 million shots in arms within the first 100 days. The president has actually doubled that. Because he got to his goal of 100 million shots in arms by day 58. So now it looks like we will actually be able to get to 200 million. So I think what we're going to do is, for this interim period, there are going to be issues, but we will probably be flooded with vaccines as the EUA for AstraZeneca comes forward. J&J, starts to get, more vaccines out as well. So hopefully that will solve itself, hopefully. But there are a lot of, for example, Closing the Health Gap is doing great work trying to find the blind spots in our community, folks who have not got access, and trying to mitigate those.
Right, and they're going to do vaccines at the health fair in late April. But,
Yeah.
okay, let me get back to some myths. And Jerri, you were saying, you've been hearing a lot, I'm just going to throw one out there. Okay, so one thing I keep hearing, and this is especially from younger people, is that the vaccine can make you sterile. Okay.
Wow. I haven't heard that one yet. But that is something that I do want to know, or explore, because there's so much misinformation that goes out. I do want to know how to combat that, because, as social media grows, it just alone in the US, we have 30 million cases. How do you get, people to be more aware and not make that a thing and scare people away too?
Yeah, social media is scaring a lot of, there is a lot of misinfo. So, and so Jerri, let me throw it out to the doctors. What about that?
You kind of touched on it earlier, Dr. Lou, about the fact that that is definitely something that people will propagate online, but it is an mRNA vaccine, and Dr. Lou talked about this beautifully. It's not going to affect your genetic abilities or affect your ability to have children. Interestingly enough, the things that do affect do cause infertility are things that we should be concerned about and don't talk about enough, like STDs, sexually transmitted infections, can cause infertility, and that will be the thing to do that at a much higher rate. The vaccine is not associated with that.
Right.
But what happens is people take misinformation and they create fear. And unfortunately, especially if someone is not well educated, we're not good at knowing how to deal with information that we find online. And so that's just an unfortunate thing. What I would say to people who have questions is ask a professional or ask someone who's had the vaccine, I think that's really what people need to do, is ask questions to the right people.
Okay, here's another myth we keep hearing, and I'm saying it's a myth, but you have to tell me. So another, I should say, fear is that the vaccine is a way for the government to track you, like to put a chip in you or something. I mean,
that is incorrect.
Kamara's laughing. You've heard that too, right?
I definitely heard that.
Oh, you've heard that, Jerri. So we
doesn't
keep
make
hearing
sense. They already have our cell phone, our
Yeah.
social security number. They know our blood type. I mean, they know everything about us.
They have our social security number.
Yeah, and so that gets to the issue of what are the ingredients for the mRNA vaccine. So you have mRNA, which is really a recipe book to make just one part of the virus so that your body will be able to recognize it. So it's just a synthetic. Second ingredient is a little bit of fat. It's called a lipid nanoparticle that surrounds the mRNA so that it doesn't break down and it can get into the muscle. And then the third is a little bit of sugar. So those are the three major ingredients in mRNA, in the vaccine, the Moderna vaccine. And mRNA only stays in your body for about 24 hours from this vaccine. So that's why your symptoms after getting the shot only last for that period of time. So, again, very safe, very effective. And there's absolutely no reason, actually. As you mentioned before, cell phones, there's a whole bunch of stuff already out there on you. So
we can already be tracked. So I'm thinking we don't need chips because we can already be tracked with our cell phones, and no one ever leaves home without them. So
right.
But well, okay, Kamara, have you heard any other? And I hadn't asked you. Are you planning on getting vaccinated?
Yeah, I do plan on getting vaccinated, mainly because I do want to go home. I want to go to Bermuda. That's where I'm from originally. And they're incredibly strict with their COVID requirements, to
Excellent.
the point where you have to pay a $75 fee, insurance fee, before entering into the island. I mean, they have very strict protocols. So I just want to get the shot, get it done and over with. I am concerned personally because I did have COVID last year in June, and sometimes I wonder how the vaccine will affect me versus someone who never had COVID. But other than that, I'm gonna take it.
Okay, and some people are wondering about that. How does that, is there a difference if you've had COVID already, so you've got the antibodies?
There should not be any difference. Let me put it this way. When you get COVID, you do get an immune response in most situations, but not all. And we don't know how big the response is. And we don't know how many neutralizing antibodies are in that response, which is totally different from getting vaccinated, where we are sure that you have a robust response. So you have a huge number of antibodies that come forward. You know, we have neutralizing antibodies in there. So it's a very reliable notification that you have it. So that the important point here too is that once you've had COVID, you can still get COVID again. Okay, you're not protected by having had COVID.
And that's the answer to a question that a lot of people, like I've had COVID too. And so that was my question early on. If you've already had it, do you need to get vaccinated? But I understand that immunity from having COVID only lasts a few months.
The other thing is as well, you know, there are tens of millions of Americans who have survived COVID, but that is not benign. That you can still have long COVID, or what we call post-acute COVID-19 syndrome, where you can't taste, you can't smell, and all these other things. And I'll specifically say yesterday, my daughter, Francesca, down here, came up with a friend of hers yesterday, socially distanced, all that good stuff. And, you know, I ordered dinner for them, and we had some drinks and strawberry. It was a strawberry beverage, and she could only tell that it was sweet. She could not tell what flavor it was. And she had had COVID. This is her friend, had COVID several months ago. Still can't taste, can't, you know, yeah. So that's to go through the rest of your life with that as an issue versus just going in and getting, for example, a single J&J shot. I'd go for the shot.
I'd go for the shot. So here's another issue that keeps coming up. It's, you know, I think the operation was called Operation Warp Speed, and we've talked about this, but let's talk about it again, because a lot of people are saying, you know, you guys came up with this vaccine awfully quickly. So has it really been tested enough?
Yes. So this is where I come up with the cake analogy. We have been studying coronaviruses, which is the family of viruses in which COVID-19 lives, or the SARS-CoV-2 virus lives. We've been studying those for 20 years. And so that's akin to baking the cake. We've already knew all this information. So at the beginning of the pandemic, we knew we only had to look at the outside of the virus, and specifically at the protein, and translate that and figure out what that unique code was for that spike protein. And it took 66 days for the NIH and the crew to discover what that you know, what that spike protein looked like, so that they could then manufacture the vaccine. So the 66 days and the last year that we've been going ahead and doing these studies is like the icing. So now you've got the cake and the icing together. This was about 21 years or so. So, you know, it's been a long period of time. It's not just been, okay, March 4th last year that everyone started thinking about what is a coronavirus. We've known what coronaviruses are.
So it's not new to the medical profession. We had just never heard about it, but it's already, it was studied, and vaccines were being developed for the last 2 decades, it sounds like.
For that family of viruses, that's correct.
Right. And then what about all these variants we keep hearing about? The South African variant, Brazilian variant, the UK variant. You know, those are here now, I understand, here in the US.
Right. So every time a virus replicates itself or makes another copy of itself, it can make mistakes. And when it does make multiple mistakes, then that becomes sort of a new virus. It changes so much far from the wild type, which is the original virus, into something that's completely different as it goes. And so what we find out is the areas that have these variants are areas where things have been out of control as far as, again, people figuring it's a hoax and they can go out and do everything else and not paying attention to the rules of masking and socially distancing in particular. And so all the names, we try not to use the country name because we don't want to denigrate anyone specifically, but so we use the numbers. So for example, the B117, that variant has been out there. There are 4 other ones, there are multiple ones that are spinning out, but the main ones that you hear have been here in the US. And this brings up the issue of the difference in the efficacies or the effectiveness of the vaccines. You heard that the mRNA vaccines were up in the 94% effective rate, et cetera. But when you come down to a couple of the other ones, they're down in the 60s and 70s. And the reason for that is the ones that were developed later were developed when some of these variants were out in the community. So they were tested not just against the wild type virus, which would be the very original one, but also against some of these variants. That's why the numbers are lower. But again, point to make here is that all the vaccines are safe and all of them are effective.
Okay, well, and let me ask Jerri. Jerri,
Yeah.
what information do you need to feel comfortable taking the vaccine?
Great question.
Yes. So someone like myself who has asthma, who's affected by, just being outside, that may have side effects to the vaccine. What is being like, what are the steps being taken for people that are having counteractive side effects, maybe because due to some underlying disease like diabetes or asthma?
Yeah, so I am also asthmatic. And I took the vaccine for multiple reasons, but being an asthmatic, if you get COVID, you're going to have a significantly difficult time. So actually having comorbidities or other disease conditions that predispose you are the reasons you absolutely should be taking it. In fact, it's more important for asthmatics to have this vaccine than non-asthmatics.
Okay.
And then Dr. Gordon, you're shaking your head. What are you, did you want to weigh in on that?
Yes. So essentially, I think what the confusion is that people who are receiving the vaccine are thinking that they're being infected with the virus in a way that they would have a full-blown COVID-19 response. And that is not the case. What we're doing is giving you a vaccine that's going to trigger antibodies to protect you from being exposed when you're exposed to the real thing. And this is something, the creation of vaccine, everyone was kind of surprised it was created so quickly. But as Dr. Lou mentioned, it's because we're much better at this than we've been in the past. It took years to create vaccines for polio and other things like that.
Mm-hmm.
But now we have to give ourselves some credit that technology and science has come quite far. And we are able now to expose the body to something that looks like the real deal and triggers the body's response when we do face the real war. And that's really what vaccines are creating little soldiers so that when the war presents, we're ready to fight. So
Right.
You're showing them what the enemy looks like by
Mhm.
showing them a quick glance of that. It's not creating a full war then, but saying, hey, this is the enemy I want you to look out for. When it
Mhm.
presents itself, attack. That's what we're doing to the body, is creating soldiers. And so for someone who is sick and has any comorbidities, especially asthma, I've had an asthmatic patient who had COVID, and she went from being perfectly fine to suddenly having shortness of breath and in the ICU in no time. And so it's unfortunate that some patient, we didn't have the vaccine at the time when she was sick, but for someone like you, and for, I think asthma is pretty common as a comorbidity, people really need to step up and get the vaccine as soon as possible.
And
So
is
just know, I think it's that fear that we're giving you the virus, but we're giving you soldiers to protect you from the real thing.
That's a great way to look at it. And so people have asked about other, since you mentioned asthma, they've asked about things like, suppose you have cancer and, you're in chemo, or, diabetes, hypertension, a lot of, lupus, a lot of other conditions. what do you do? How can you find out whether you should take the vaccine or not?
Well, you do want to have a relationship with your primary care physician, and always ask your provider if you have additional questions specific to your situation. But the general rule is that if you have a comorbidity and you're Black or Latinx, that by itself puts you at a little higher risk. So this isn't, the virus it doesn't discriminate from the standpoint of it's Russian roulette. If you think, oh boy, it's just not going to affect me because I'm young and I'm healthy, you just really need to make sure that you realize it can affect anyone. It does not pick and choose, but it is more likely to happen in African American and Latinx individuals and those individuals who have comorbidities.
Okay, and here's something from Facebook that's coming through, and it says to Kamara and Jerri, thank you for being truthful and open to your concerns and fear of the vaccine. Good to hear your thoughts and hope this session helped women make their choice. It is important, we don't always want people just to say, yeah, I'm taking it when
Absolutely.
really they're afraid to. Well, let's talk about children because Jerri has an 8-year-old.
Yeah.
And so right now, I think we're only vaccinating 16 and older. What about children?
So Pfizer does have a trial that's going on here actually in town, 12 to 15, and they're called De-Escalation Studies. So they're changing, the dose and using it in younger and younger folks as we go through. They usually start with a small group of kids, about 8 or so kids for this down to 6 months is the next stage that they're doing. So really we vaccinate kids at birth. Okay, so having kids vaccinated is not brand spanking new as far as things go. But again, with the incredible safety and efficacy, effectiveness of these vaccines, it's very likely that we will find that these are safe for the younger kids as well.
And this is an ongoing question. We've been through the vaccination or we're about to go through it. What about next year? Do we have to do this again next year or are we safe for several years?
So that question has not been fully answered. And again, that's why I'm in the study for the full 25 months. But what we find is that for vaccines, if you've got good immune response that lasts for at least 4 months, it's more likely to last in the number of years. So, possibly 1 to 2 years. I don't expect, based on the fact that my antibodies are great, and all the folks that are in the trial that got to in Moderna that got to the 4-month mark had blood drawn, and their antibodies were very strong. So again, we hope this won't be something where you have to take it every year like the flu vaccine. Hopefully it'll be longer than that.
Okay, all right. So we're kind of getting close to the end, but I want to make sure everybody gets a chance to make some final comments about this. So anything that we haven't touched on that you feel is so important for people to know. And let's start with Kamara.
One of my really good friends, she's into homeopathic medicine. And she was telling me that she doesn't want to take the vaccine. She'd rather take zinc, vitamin C, and vitamin D to build her immune system. And it reminded me of this doctor who did a press conference, and I want to say in Texas, a Dr. Stella Emanuel, who was talking about how she was able to cure her COVID patients with vitamins. I want to say she used zinc and then a Z-Pack to heal her patients, her COVID patients. And, there's a lot of information out there, and people trying to do their own research for their own, in terms of looking for, I guess, the homeopathic route. And it's so confusing because, myself, who's about to take the vaccine, if there's another way or a natural way of doing it, I may want to go that route. And I know that my friend definitely wants to do that as well. So I would love to hear your input regarding that matter.
You know what? I'm a big proponent of zinc. And so I'm telling you, when I had COVID, I was taking zinc and vitamin D and vitamin C like crazy, but it was after I already had COVID. it didn't, I don't think it prevents you from getting it. It's just maybe a way of treating it. When President Trump got COVID, they were like, okay, we're giving them zinc and vitamin D. And I told people, I told you, but the vaccine is to keep you from getting COVID in the first place, right?
Right. And then we didn't talk much about treatment, but there are treatments out there as well that patients can use. And in fact, we have a pretty good supply of them in the United States right now that are through the IV. But zinc does not work against COVID. That's just a fact. One of the things that we get concerned about is when people are doing their own experimentation, that they don't have the numbers and the rigor that needs to be put into place to actually state that you didn't get better because of chance, right? So the Moderna trial, for example, had 30,000 people in it. And so it's very difficult for individuals to go ahead and give 15,000 people zinc and 15,000 people no zinc, and then to figure out, in their own studies with their own naturopathic things. So, again, there's always room to go ahead and test different things, but what we do know is that does not prevent you from getting COVID.
Yeah, Kamara, that's a big point. Dr. Gordon, I'm gonna let you weigh in because you're really the medical person, but all those treatments were after after people already got sick. So the vaccine is so that you don't get COVID in the first place. Dr. Gordon, I'm sorry, go right ahead.
No, you're perfectly fine. I was just gonna say, so I'm Jamaican. So, my father calls me and he's like, gargle with your salt water, drink this bush tea.
Mm-hmm.
And my approach, so I grow up with that natural path. And my approach is do both. Okay, get your vaccine and also do your natural remedies, because I do feel like, and as a doctor, this is my practice, I welcome both things once there are not going to be any side effects that are going to affect the patient adversely.
Absolutely.
And I think patients need to feel that they can have some autonomy in doing certain things. And so I would say do both. Don't experiment with your life, because that's what, unfortunately, you're risking. But go ahead and get vaccinated and also continue doing your zinc and your vitamin D and build up your immune system just in case, this vaccine does expire in 1 to 2 years or whatever the case is. But go ahead and do something that helps to make things better. And so I say do both.
I love that. Don't experiment with your life. Okay, Jerri.
Well said.
Yes. So I think one of the things that, like, learning just out being in the community, a lot of people are not knowledgeable about their lymphatic system, and like it's like an input system. You input whatever you input daily, you're gonna get outputted. And I think that if we have more resources that can explain to people, what like your daily nutrition and daily value that you put in your body is going to affect your your long-term stability and your health. And I was explaining this to my mom, and she's a nurse, and she's like, my friend got COVID and she drinks her elderberry and her and she goes for a run every day. And I was just like, it doesn't matter. This is a COVID-19 is actually a virus. It's going to spread like a wildfire, because I actually wrote a paper about it but prior to it hitting, how quickly a pandemic can break out when in less than 90 days it covered the entire world. But if you were already not nutritionally care about your body or your health, or you're not making sure you're eating your greens and you're taking your vitamins every day, your immunity was probably already low. And so that's why people like me, they're like, that's on the fence. It's kind of like, okay, I'd be the first person in line if I knew that like I would never get COVID again. But now that I've already had it before, I want to know, like, what is it gonna take to make sure that I don't get it again and have the same effects. I think I had a migraine for 14 days, and I was just like, oh wow, that must have been my string of COVID. But because when you go on the internet, Google says all the symptoms are flu or cold or sneezing, like itchy throat. I'm like, so everything is pretty much COVID. Just stay in the house. Like,
So
that's
Yeah, so just to that point, all of the vaccines that are out, and I'm talking globally now, we've got 3 that are FDA approved here, but there are 2 additional ones that are out there as well. So AstraZeneca is still waiting to be approved, and then there's Novavax. But all 5 of them have shown that there is nobody who got vaccinated that got into the hospital with severe COVID, and nobody died. So all 5 vaccines will prevent you from getting hospitalized and also prevent you from dying. So that by itself is really compelling. And these are thousands of people if you added up all the people in all the trials.
Okay.
Thank you so much. You know, we're out of time, but I just want to say, because of this information, this is why the Center for Closing the Health Gap sponsors the COVID-19 communityresources.com town hall meeting and has their website so people can get real information. And so I want to thank all of you. Also, you know, I've got to thank our partners, the Cincinnati branch of the NAACP, the African American Chamber of Commerce, the Urban League of Southwest Ohio, and the Cincinnati Medical Association, our Association of Black Doctors. We thank all of you and all of our panelists. Thank you so much for joining us. This information is just so vital to our community. We need the real facts. You're providing them and sharing the information and your fears and concerns. So we really, really thank you for that. So we will be back. Renee Mahaffey Harris will be here next time, as will Tropicana from the Wiz. And we will see you next time on the COVID-19 communityresources.com town hall meeting.
Thank
See
you.
soon. Thank you.
Thank you.
Thank you.